The month of October is ADHD Awareness Month, but it's not just children who struggle to focus and sit still. More adults are learning they've been living with undiagnosed ADHD their entire lives. For more insight now, let's welcome Dr. Jackie Shiels, a clinical psychologist with Kaiser Permanente. Thanks for being here this morning.
Thank you for having me.
What do you think is behind this increase in diagnoses among adults?
Well, the more we know, the more we see, and it's actually never too late to know your brain better. So attention deficit hyperactivity disorder, or ADHD, where folks are struggling mostly with attention, impulsivity, forgetfulness. It's not so much about working harder, it's more about thinking differently. And we have more awareness, therefore we have more evaluations, therefore we have higher rates.
Now, how do some of these symptoms manifest in kids versus adults?
So very similarly, what we often see is attention difficulties. You can't pay attention, you forget things, you're late, you have unfinished tasks, you might be kind of hyperverbal, or maybe you're oversharing. So there's a variety of symptoms that we see in children and adults that actually look very similar.
When does it become a problem?
When do you feel the most impact? Are your relationships being impacted? Is your work being impacted? What we often see are these symptoms manifesting itself in the workplace. You might not be able to finish your tasks. You might have deadlines that are late, or you might be just overall more unorganized. And oftentimes folks at work might be overlooked for promotion. They might have brilliant ideas, but the execution is messier.
And these symptoms that you described kind of exist on a spectrum. At what point is it too much, and what should people do in that situation?
I think people really know themselves. They know themselves best. If you're struggling with trying to keep up at work, you sign off at work and you're doing 2, 3, 4, 5 hours of work after. And it's not just trying to do more, it's trying to complete your basic tasks. That's when you should look inside. And honestly, when you are struggling with these symptoms, you know most, and your loved ones know most. Ask your PCP for an evaluation, and then we can talk about treatment too, if that works. So.
Right. So, I mean, I was going to ask about treatment. At what point should you be trying to find tips to do this on yourself, do this on your own, and at what point should you maybe seek out some medication?
Yes. So I like to think of it like this. Stop guessing and just ask. Call your PCP, ask for an evaluation. And if you are somebody who does get diagnosed with ADHD, it's important to consider what kind of behavioral skills training will help you learn better. It's not about working harder, it's about learning your own brain. So medication, behavior skills training, and have self-compassion. If you are feeling big stigma with medication, try behavior skills for 6 months, reassess it, talk to your loved ones, and if you're still struggling with all of these symptoms, that's when you should entertain the idea of medication.
How complicated is the process for getting formally diagnosed?
It's not complicated. It's really not. You just have to have the awareness, write a message to your PCP, organize an evaluation, and then understand your results. And they will give you a lot of information about your brain biology, your executive functioning, your planning, what's hard, what's easy, and why.
You mentioned that an increased awareness can lead to more formal diagnoses, more people reaching out to their practitioners to find out if they fit this criteria. Do you worry about the medical community possibly over-diagnosing this condition? How much of this is a neurodevelopmental condition that extends into adulthood, and how much of it is a function of our highly distractible, chaotic lives?
Fantastic distinction you just made. So what we know is that ADHD can often hide behind anxiety, depression, even poor sleep. They look very similar. And diagnosis can be really tricky because of this. Some folks really do have true ADHD. Other folks are very overwhelmed. And I think we can all relate to that. Overwhelmed lives look like ADHD lives.
So the only way you can tell the difference is by reaching out to your medical provider.
Yes, better understand yourself. What kind of mental health issues do you have? What kind of attention issues do you have? Are they recent? Are they recently triggered? Or perhaps they're more long-standing, and that will help inform your diagnostic clarification.
All right, great advice there, Dr. Jackie Shiels, clinical psychologist with Kaiser Permanente. Thanks for your
Allie.
insight.